Okay, on a kusha, on a kabo, on a welcome to the Well Body Better Pass Gently program. We na Salomon, then we don't learn boku book. Like what I say, not to me, they want to learn boku book. The doctors, them, physicians, them, pharmacists, nurses, and then they present, now they bring this program to now. Who they bring this program to now, we none, not they get paid. We do them free because we want to help people them. So if I know somebody will go benefit from this, I share the message far and wide. Let other people then benefit. And for them benefit of them people in it because some man in phone not good or maybe not get internet, now make they record the program and put on a public forum for let other people that won't able to attend today and go able catch up. Okay, and maybe watch them, or maybe some of we say maybe sometime down the line we want to go back and review and reference, we can go back to that program day and catch up. Okay. And dear me family, we know they provide personalized advice now. The reason being, not also no one help, but we don't know which one on our medical background. So just for let you can know, tell you as soon as they happen, we're not able, based on that information, they give you a diagnosis. So they advise if you get any questions, go to your physician. But the advice they would give and a general advice, some of let you know waiting then, some of them TRB. If you get how for deal with them, how for handle, for manage them, so if go for seek help and advice and then kind of thing and they okay. If you get something where you want to talk to one part of the doctors, them I will say try for contact with privately, then we'll see what thing we will do for help. But still, the final advice will be go see a doctor or go see a physician. Okay. Today at the 71st session and at the last session of this year. So Dr. Rashid, no pressure. And today we do with reversing chronic diseases. As we know, not to hypertension no more, they get various types. But if you say no more reversing chronic diseases, you when I go to feel so they can talk about all. And if we say they talk about 1 month not good enough. So instead, we only focus on hypertension. Okay. And like I said, today that's Sunday, the 10th of December, and our Dr. Rashid Conteh now in the present to now today. And me, your name, Natimo John Fuller. Me, not a medical person, and again, no medical background, being a business IT consultant. I work with computers and stuff like that. Now that they do. And my specialty now information security. Okay. So we go start. And like what I say, I'm not just actually no more. Now in the present, but we get a whole team of people and professionals. Then we're emergency medicine consultants, we get GPs, we're general practitioners, we get physicians, we get pharmacists, we get what they call them people, nutritionists. We get the team vary. We get people with various disciplines. So most likely for any question we have, somebody must be within the team, we go able to help. And also the gynecologist. And not we all based in England, me based in England, but most of it based around the world, so the Germany, US, and different places of the world. Okay. Let me start. Like what they say, we not they get paid, we do them for free, and the program we do them in Creole. Not also they say people not sabi speak English, but it better not do them in Creole, so people can go understand what they say. But also if you go see your doctor, you understand what do you and you know what for go ask that doctor how for put them. Okay. If anybody gets any way for let this program reach the general masses as alone without will cost we money, we're happy for getting material free of charge. Let them put it on the channel them, let people and benefit. However, we're not going to take the time and resource and do all of this, then I expect then people expect to back for no pay. Unfortunately, some of the channels and they don't propose. Okay. Now, they say the information will be available on YouTube and Facebook. So they are, if you miss this program or any of the program, then you want to go back and catch up because we can't get a long break now. Say January, we're not going to come back. So during that period, you can go back and have a look on the other sessions that will be done do and try for recap. Okay. Now, as I say before, if you want to ask question at the end, there are various ways for you to ask question. If you look at your tablet or your phone, you see this, you get 3 dots, then I have. If you want to chat to you and send me a message, just like how you do on Facebook or WhatsApp, you can send me a message for ask you a question or even just comment and see what you do well. And not bad still. Or maybe when I do so well, maybe at the top boku, so you can tell me that this still. All right. And you can raise your hand for use this. If you raise your hand that way, I will come to you. However, if you not sabi use all of this, just raise your hand physically. When I see you, I will make you know say I don't see you. Then I will come to you. If I not see you quick, you know mean say I ignore you. Mean say sometimes the people in Kimboku and other people in other pages them. So I go for scroll along for find who that else want to ask questions. Okay. And like what they say, we're not perfect. No matter how we do things, then people are and people who don't learn, and most of the time when they deal with things now between their own fellow professionals. Now then they try for convert that professional talk for make them low so everybody, the layman where they even upline go understand. So sometimes we can make mistakes. So there, if you not feel say we they make mistake or there's something they will for improve on, feel free and WhatsApp number this. I will share the group link later. But also you can email we say, oh, when I do well or no, I want to improve, or maybe there's a certain topic where you want to hear about. There, make we know. Because this program only do one for we self, not for one we do one. So now I don't talk beaucoup, I can down hand over now to the professional. Let's take on through on a session today. Okay.
Nina Rashid Conteh. Now, thank you for coming our last session today for this year. On behalf of the Well-Body Better Pass Gentry, I want to take a moment for extend we heartfelt condolences to all the families and friends we've been lost loved ones on the 26th of November last month. That might be a big national loss, and we all pray say God will comfort we all, more so the one that we lost and loved ones. Today, we dey talk about how for reverse hypertension. Hypertension now one of the biggest cause for heart attacks and strokes. But plenty but we no even know say we get this CPR way, no they actually transfer from person to person. For una way we don dey join we, una go remember say Dr. Kamara been don talk about this CPR, hypertension. Today I will just remember we quick before I talk about the main interest way now how for reverse hypertension. So for do this talk here, I will try for define within hypertension. Then we will get a short quiz, small test. Then I will talk about how they classify this CPR. Then the types of hypertension. Then we'll talk about the normal blood pressure readings by age. We will also talk about the world statistics about this hypertension. Then we'll talk about the salon statistics. We'll also talk about blood pressure readings. Then we'll talk about the risk factors. Then the symptoms of hypertension and nutritional deficiencies wey can cause hypertension. That is, we will not get certain things that I will eat, we will cause this condition. Then we will talk about complications of hypertension, then treatment, and then we will come what I really want to do when how for reverse this situation. Una all know say WHO, World Health Organization, now the big boss, now the whole world, but well-body business. This organization or them people are then know very well the wahala way hypertension they cause now the world. So much so that then dedicate a whole day when I May 17 for let we all remember hypertension and let we take caution, what if for do for prevent ourselves from this disease. But what's in hypertension? Well, hypertension or high blood pressure are the same thing. Blood pressure now the strength or the force way the heart they use for pump blood around the body through the blood pipe there. And where this reading can go up to 140 over 90, then we can say this person gets high blood pressure. I want let una all fold una hand, whether na the right hand or the left hand, and look at the box where you don't make. Then we answer them question yeah quick. Sorry, just need to move something. Okay, so when they look at the box where you don't make, which body organ weigh nearly as big as the box where you don't make? Are the kidney, the heart, the gallbladder? Number two, wetin are the distance around the world, the total distance for go around the world? 24,900, 70,800, 100,000. The last question, if we for take all the blood pipe in the body and to line them all, wetin are the total distance? 5 miles, 20,000 miles, 60,000 miles? Well, if you answer B, A, C, that is question 1B, question 2A, question 3C, good those you answer correctly. But if you miss any of the question then, una no worry. By the time we dey done, you go know for yourself. Right, so how for classify this CPR? If we look at the third row from top, we say 2018, that is the European Society of Cardiology and the European Society of Hypertension. We see say the first group where they say systolic blood pressure less than or equal to 120 millimeter mercury, or the bottom number when the diastolic pressure less than 80. This is normal. If you go to the second group, we say 120 to 129, in back normal. If you go to the third group, this may be normal but high limit, when 130 to 139 millimeter mercury for the Pantap number, and the bottom number 85 to 89. If you go beyond there now, you will reach 140 to 159. This is first grade hypertension. You go further right, 160 to 179. This is now grade 2 hypertension, and then grade 3. So if you there now group 1 and 2, the lifestyle where you've been done the live, just continue with that. You find you're able to maintain your blood pressure. However, if you reach group 3, when at the 130 to 139, this one means say you get for modify, you get for do something with your lifestyle. Maybe you're not going to need for take medication at this point, but certainly you get for do something with your lifestyle so that you go able to maintain your blood pressure. However, if you don't jump go to grade 1, then yes, so you will need for take medication. Plus, do something about your lifestyle. Same way so for grade 2 and grade 3. This is not the same thing where I don't talk. Then we look now the types of hypertension. Well, we get two main types. The first one we call essential hypertension or primary hypertension. This now the kind hypertension where most of the cases they fall into. That is 90% to 95% of the people there with the hypertension, they are this group. However, the second group, where we call secondary hypertension, in get a number of causes. The one family list now hyperaldosteronism. This now the glands then where they tap the kidney, where sometimes either tumor or cancer, or for some reason then they produce too much aldosterone, this hormone, and because of that, they give hypertension or high blood pressure. So if the blood pipe where they supply the kidney for whatever reason is narrow, is small, Then the back, they make the pressure go up, the blood pressure go up. Well, for the one that we been done the join, we now know say we been don't talk about getting our throat. This back now, other sick, if you get them, the blood pressure will go up. But other condition they way we call Cushing's syndrome. This na condition where the body they produce too much of hormone where we call cortisol. This hormone na hormone where the body need normally for when they under stress situation. But if the body they produce and too much for a long time, that will be hypertension. Other reason where we call pheochromocytoma. This na tumor or cancer where the adrenal glands then get, then glands are then deep on top of the kidney there. So if any of them glands are get that tumor there, then they back will cause hypertension. Self, if they take too much pain medicine there, painkillers, what we call, like brufen or naproxen, then they back can cause hypertension. Other reason, the main blood pipe wey comot at the heart wey dey supply through all the body wey we call aorta, if for whatever reason e narrow or e small, then the back dey cause hypertension. Or some people dey wake in draw sleep, this back dey cause hypertension. Same way, so some people dey wey time reach for go to doctor, as e reach doctor in office, e don become anxious. And that anxiety they cause back hypertension. On the other hand, some people that way their own their blood pressure they just fluctuate. 1 minute they up, the other minute normal, then they back hypertension. But other one they way anything happen that somebody just drop something or say something way shock them. The blood pressure they spike up to very high level, where we call malignant hypertension. This back they cause hypertension. The last one now, where woman dey pandele, then the back will cause hypertension. Well, now we try to understand what the hypertension or the blood pressure readings they mean. We get two numbers there where they can write like a fraction in primary school. Number, this fraction, the top number, often is bigger past the bottom number. So waiting at this top number. Well, the top number, it means saying at the term where the heart they squeeze the blood out of the heart through the aorta, the big blood pipe, for make the blood go through all the body. That term the way the heart they squeeze the blood for let it come out and the heart go to the body. Now that term they we get this reading where we call systolic. After the heart don't squeeze the blood don't come out, small term day where the heart they relax. During this relaxed term, the heart they fill back with blood from the lungs for start the other cycle. So that short term day, now they will get the bottom reading where we call diastolic. Okay, so Fambo, this slide is just to tell we normal blood pressure readings then, depending on the age of the person. For example, where person old, between old 1 month to 12 months, the normal blood pressure can be around 90/60. But where person old, let's say from 20 to 24 years, the normal blood pressure can be 120/79. Same way, so where person old like 40 years to 44 years, the blood pressure can be 125/83. Or if you old 60 years to 64 years, we expect your normal blood pressure for 134/87. This just the tell we say as they grow old, the blood pressure reading they increase. This not because naturally the blood pipe then they lost their elasticity or then they stiff small, where they make the blood difficult small for flow smoothly. Next. No, I think you make the wrong. All right, never mind. I mean, don't amend this, but we can go with that. Now we talk about the symptoms of hypertension. Where you get hypertension, what you be happy with the body. Well, hypertension of its own not get symptoms way specific to her. However, if you get hypertension, you can get headache, your vision self can change, sometimes you know they see better. You're not can able to blow fine or normally, you can blow like person will get asthma. You know self can bleed. You can feel like you ate the tongue. Sometimes you can get chest pain. Yes. Now we look at the world statistics of hypertension. Well, around the world, for people that weigh old between 30 years to 70 years, the number of hypertensive people there they don't increase from 650 million to 1.28 billion. This now between the years of 1990 to 2019. One study there we say about 53% of women there and 62% of men there will get hypertension. They are not they take treatment. Also, other studies there we say every 1 out of 3 adults get hypertension. Also, now the US alone, 137,000, sorry for the extra zero, it will be 137,000, they die of stroke every year. Next. Now we look at the Salon statistics. For people that weigh all up to 40 years or more, one study tell we say 44% get hypertension, na Salon. But this now during 2014, and it go up to 50% during 2020. Then we do other study in Kenima Government Hospital by Dr. Lisk, Jurodami R. Lisk, and other man. Then study, then tell we say the hypertension cases them plenty, but the awareness is so small, is so low as a low. But a study, 2021, tell we say 22% of the people there as alone get hypertension, probably because they don't begin for test more for know whether they get hypertension or not. But the one important thing also is if we take 100 people that will get hypertension, only 23% now then they get diagnosed for no say they really get hypertension. And out of that 23 days, now only 11 people now then they take treatment. Then for that 11 people, then they remember from 100 people will get hypertension, now 23 now then diagnosed. Out of the 23 we diagnosed, now 11 now then they take treatment. Out of the 11 where they take treatment, now 5% normal. Now 5 people they able to control their blood pressure. Next. Next. This now one important study where they do na Salon. This study na one university in Holland inside Utrecht. Now then sponsor with another university in Norway. Now then sponsor this study. So the total number of people where they take part in this study now 3,618, and then age is there between 0 to 100 years. But 2007 out of that number there, then all 18 years plus. And some them been there for drop off because either them blood pressure reading missing or them they do other thing way no match for the study. So because of that drop rate, now only 1,956 people then be able to complete the study where they fully analyze. And out of this number, 644 then be in a city, but 1,312 then be in a upline. Next. So inside this study, they look at boku aspects of the Salone population. For example, then look at the one that way go school. Whether the one that way go school and the one that way not go school. Then find out say the one that way not go school now 1,079. And out of that 284 we get hypertension. But out of that number there, now 53 no more than diagnosed. And out of that 53, now 27 now then take treatment. Out of the 27 we take treatment, now only 9 able control their blood pressure. The other one there, then just start in primary school. The other one then they just start in secondary school. The other one then go college or university. They all get them figures then. Next. They also look at we tribe them as alone. Then look at the Creole, the Limba, the Mende, the Timni, and others. These others include the Fulade, the Susu, Mandingo, Shabro, Loko, Gisi, all the other tribes there. Then find out, say, for example, if we take let me say the Mende, just random. Now 662 will take part in the study. Out of that, 119 get hypertension. Out of that, now 18 no more than diagnosed, which means now 18 no more test or take them reading for make them able to diagnose them. But out of that 18 day, now 9 no more take treatment. Then out of the 9, 8 now they able to control their blood pressure. So we get all their figures then next. Where they put all the information where I don't tell you now, so then put them neatly and then graph here. Like what I've been on the top. Out of the 100 people that weigh their hypertension, 77 of them want them they don't know. Now only 23 know say they get hypertension. And out of that 23 day, now only 11 now then take treatment. Out of the 11 will take treatment, now only 5 people then are able to control the blood pressure. Same way, so then compare between man and woman, the second graph. Out of the 100 where get hypertension, now only 18 man there, now then diagnosed as then get hypertension. Then 26 and the woman there. Out of the one that we diagnosed, now only 11 man there now then take treatment, and 12 women there now then take treatment. Out of the one that we take treatment, now only 5 man there now they able to control their blood pressure, and 4 women there. So now the information down the way then graph here they tell you. Next. Now, if we try for compare the number of hypertension cases in Salone compared to the one whole world, we in Salone Tower say we forbid the world record. So we get over 40% hypertension cases, where the world is around 35%. This is very serious and unfortunate. Next. Now let we look at the risk factors. What are the factors there where they make we get hypertension? Well, they're divided into 2. one a personal factor the way we're not able to do anything much, like if we're a man or woman, or if almost here we old, or if we're not black or white, or the family we side we come. We're not able to do anything with them factor here. However, the other factor then at the right hand side, when are modifiable factors, we're able to do something with them factor here. They include stress, smoke, salt, inactivity, that way we know the exercise, then alcohol, drunko business, or way we fat too much. Next. We will find out, say, when we look at the factors here, high blood pressure or hypertension, now sick way really get for do with how we live with life there. For example, if we not smoker there, if we not drunko people there, or if we fat too much. We find out, say, if we not address all the issues here, then we will get more problems. For example, we will either get heart attack or heart failure. We kidney themselves, then go back. Next. So now we look at the factor, the way we will control, how it affect the body if we not do something. Some man there, he just left for it plenty salt. Even if the salt do and the plazas and the rest, he will let for sprinkle back salt where he dey eat. When you do that, you dey give problem to the heart. Your heart not go function well. You either get heart failure or heart attack. Self, your kidneys then will get problem, then will back up. The skin self will get problem. Even the brain, you will likely get either stroke or heart attack also. Even the bone then self, the strong way they get, the strength way they get, it they reduce, then will become soft small. Yes. How about the smoke? Well, if they smoke cigarette, they cause, then CPR will divide it into two, first of all. Either they get cancer or some other chronic disease. The cancer there, they could be at the head, at the neck, the lungs there, the blood self can get cancer, or the gut, the stomach, or the kidney then, the pancreas, the gut, the bladder, or the cervix in the case of women. For the other chronic disease there, now the head, we can get stroke, or we either can blind, or the gum there, inside the teeth then down, it can become infected. The main blood pipe in the body where they supply all the body, they come out from the heart, where we call aorta. Itself can just burst. The heart itself can get problem, whether a heart attack or heart failure. The lungs themselves, we they expose ourselves to pneumonia. We can get pneumonia anytime. Even the blood pipe themselves, then they become stiff, so much so that the blood not able to flow easily. Down the back, they cause the hypertension more. We can also get chronic lung disease and even asthma. The mommy and daddy business, down the back, they broke down if we smoke and get hypertension. The hip bone then can easily fracture. Next. We all know, say, chemical then there na the cigarette there or the tobacco, where they cause damage in the body. Some of them damage include the blood pipe there, then they become small, so much so that they become difficult for let the blood to flow smoothly. Also, the oxygen supply to the heart, it become reduced, and the heart they pump fast. Now for try compensate for the oxygen way not sufficient for the heart. Also, the blood can clot more easily than if you know the smoke. Other air there, where we call nitric oxide, This is a very, very important molecule for the heart because it dey cause the blood pipe dem for let dem open up so that the blood will able flow easily. When we dey smoke, this air, this molecule, it dey become less na the body and the hypertension will crop in. Also, the blood pipe dem, the inside of the blood pipe dem, it dey become dysfunction, e no dey function well. Sef, dem can swell and block the blood for make it flow smoothly. Next. So when we no dey exercise, when we no dey yange, we no dey move about, all side of our body dey become affected. The heart, the lungs dem, the muscle dem, the brain, the part dem wey responsible for mommy and daddy business, even the gut, the soldier man dem na the body, the bone dem, then the chemical messenger, dem all dey get problem if we no dey exercise, we no dey move the body. For example, if na the heart, you go either get heart failure or heart attack, or if na the muscle dem, the muscle dem go, if we no dey move dem, we no dey exercise dem, then they become smaller and less functional. Same way so with the brain, we go get stroke if we no dey exercise because the oxygen no dey circulate freely in the body, na the brain. So all the body parts dem dey become affected if we no dey exercise. Next. Same way so the stress, I bin don mention but the stress earlier on. When we get stress for too long, for like 3 months or 6 months or more, down there dey cause for let the blood pipe dem small and the blood not dey able flow smoothly. That dey cause hypertension. Next. If we too fat, this na big problem because all dem condition wey we dey see around this fat body, dem can happen. That can easily make you draw sleep, wey mean say the brain no dey get enough oxygen when you dey sleep. Something dey wey dey block the air pipe wey dey supply the brain. Sef, your cholesterol dey go up, wey itself can able block the blood pipe dem wey dey do hypertension. And if you fat too much, it can get cancer easily. Sef, wey you fat too much, diabetes no dey near you, the high blood sugar. While obviously the pressure dey go up, the blood pressure, and other heart disease like I don say. Next. For some reason, hypertension and diabetes, then I just padi them, and they call them padi them. But we don't know exactly why make them one for be padi them or them be padi. However, some scientists then say now where the body they produce too much insulin, they make person get diabetes and hypertension. How this they happen? Well, first, where too much insulin then at the body, it cause the kidney therefore let them retain more sodium and water. If we no say any size sodium day or any size salt day, water day. So if too much insulin then at the system, that they make the kidney then retain salt and water, and that they give overload to the heart for make it pump the blood around the body. Well, the number 2 way there why be padi, and say where the insulin too much in the blood or in the body, that they cause for let the brain release chemical then, and then chemical then they make the blood pipe then small, and where the blood pipe then small, that they cause high blood pressure because the heart therefore make more strength for make it pump the blood around the body. Next. Next. Some other minerals and vitamins, then they, if we not get them by the food where they eat, then they back can help for them with their hypertension. Some of them minerals here, they include magnesium, calcium, potassium, sodium, the vitamin C, and some amino acids like arginine, vitamin B1, 2, 6, 12, even the folate and vitamin D. Next. Next. Sorry. Okay, so now what are the complications where high blood pressure they cause or hypertension they cause in the body? I think I don't touch on most of them. Where we get hypertension, where we know the control, we can get stroke out of that. We can go blind, or we get heart problem, whether an heart failure or heart attack. With kidney themselves, they can get problem, or the mommy and daddy business can back up. Next. Same thing with the I don't talk so. Where we know the control with blood pressure, the heart, the kidney, the brain, the eye, they all they get problem. Next. So how hypertension they affect your body? Well, I don't talk about this. If we get hypertension where we know the control, that can make we get depressed, or we they become too much anxious, where again they lead to more hypertension. We heart can be either, we can get either heart attack or heart failure. The mommy and daddy business can back up. We can also get stroke, or with a loss with sight, or the kidney then can back up. Then the bone themselves, then they lost their density. The bone then they serve small. Next. How for treat this high blood pressure? Well, this slide just the tell we say not to one size fits all. Plenty type high blood pressure medicine than they. But the message here is each of the tablets here get side effect, plus they cost money. So if we don't reach now a side where we for take them medicine here, why we not go try for adjust with lifestyle, so that in time, sometimes if we serious and then we go able left some of them medicine here or come out of the medicine there completely. I not mean say now for left for take medicine there, not to the message down. Next. So how would they reverse this high blood pressure? Well, as I've been on the say, now for loss the extra weight, now for the exercise regularly, now for eat healthy diet, now for left for smoke, for reduce the salt way we dey eat, we for left the drunker business. If now 1 glass per week, that not too bad. Then we for sleep well. So they don't for sleep, we for able to sleep well. Then we for monitor with blood pressure. Although some Monday, if now in the taking blood pressure, the panic can make the blood pressure go up. If that's not the case, then now for go na clinic or go na hospital, let them go they take care for you. If not 3 times per week, then they fine. We can get support groups there. People there where they're all na hypertension patient there. They can come together and talk together, or sometimes see one doctor where they able advise them, or them groups there where they able advise them. We for reduce with stress, and we for avoid too much caffeine or black coffee. Next. This now just for show how for loss the extra weight, so that we heart will gladly for do invoke. Next. We for exercise, we for move about. How they exercise? It can be say now waka with a waka, or for run or for jog. We can do skipping or go up and down the stairs, or for swim or ride bicycle, or weightlifting. Self if you want, we can dance or play football, volleyball, basketball, lawn tennis, etc. All the activity can help we for level low our blood pressure. Next. Let we adopt a healthy lifestyle. Let we change the pathway the way not very healthy. Let we get moving. Let we focus on our nutrition, what we dey eat. Let we cut down the salt wey we dey take. Let we take we medicine dem once we don get hypertension to a certain stage. We for check with blood pressure regularly. We for lose the extra weight. I don show una how the too much fat dey cause sickness with other body parts dem. Self the drunker business or the too much smoke, we for left down there. Let we reduce the stress wey we dey for, whether na work stress or family stress or any stress. Let we sleep well. Down there go help we for reduce the blood pressure. Next. Some eat dem dey, food dem dey wey dey help we for lower we blood pressure. The vegetables there, the leafy, the green leaf vegetables there, the blueberries there or strawberries, the beetroots, the banana there, some fish like the salmon or herring, some wild cabbage or even the garlic, dark chocolate, some nuts them or pomegranate. All them food I'm not too sure which one there where we get na salon, but I know say we get vegetables, we get banana, we get tomato, we get other fruits there na salon, we get garlic. All that why they help for lower the blood pressure. Next. Next. I've been talking about nitric oxide, where na molecule na the body, where they tell other body tissues, other cells then na the body, waiting for do and when for do it. This molecule enrich na them food type here where at least na the high producing food them. Then are like beetroot, cabbage, broccoli, cauliflower, etc. Lettuce, the one they way there na the left hand side. The middle na the one where they produce medium nitric oxide. They include like celery, aubergine or eggplant, garlic, watermelon, potato, strawberry, tomato, etc. The one that will get low nitric oxide, they include banana or bean sprout, cherries, chickpeas, onions, etc. Next. Next. Okay. So that way now more food there where they help me for lower with blood pressure. Let us call them plant-based food there. We not talk about the the blueberries, the strawberries, banana, the carrots there, etc. The apple there, they are all the help for lower with blood pressure. Next. This now surprise study findings. Most people believe say brown rice better pass white rice. Well, the difference not really much, but the message here is we get for land for limit or for reduce the amount of carbohydrates where we take. We know say carbohydrates, they mostly not the starchy food. So the white rice, the total number of calories according to this study and the size of bowl where you see at the picture, they give 129 calories. The carbohydrates roughly na 28 they give, whereas for the brown rice, they give 122 calories, where the carbohydrates are about 26 roughly. So the difference not too much. The only perhaps significant difference is if you talk about the the fat. The brown rice, they give 0.96, that we say about 1 gram, whereas for the white rice, about 0.3. So that's the main difference. But otherwise, in terms of carbohydrate, much difference no dey. Next. Next. Then we do a study na Harvard University in the US, where they call dietary approach to stop hypertension, or DASH for short. Then get two groups of people there. One, they subject them to this diet. As you can see, now mostly plant-based diet, apart from the two kind fish that way they are salmon and herring. Otherwise, you get broccoli, grapes, apple, aubergine, blueberries, beans, etc. So this or plant-based diet now make up the DASH diet, when a dietary approach to stop hypertension. On the other hand, the other group then just left there for let them eat what they want. We can see the results of what happened to them people after the period of study. Next. Next. So as I say, then find out say the one that will just eat, continue for it, waiting they want for it, especially the food that will get high sodium or high salt, then blood pressure, the high up na the red line. Whereas the one that we then at the group we use the diet for stop hypertension group, then blood pressure just normal, they down, regardless of the age group. Until I've been telling I say the pressure can go up as we get old. Well, yeah, they factor that in, but still they down about normal. That's why we say if we amend or adjust with diet to plant-based diet, we can reduce the blood pressure. Next. As I been on, they say now for reduce the salt way we eat. Next. Now for left for smoke. Where we they smoke, the side where you see black branches there of that tree, now the lungs there. The tobacco don't black in the lungs there, so much so that it's easy to forget cancer or forget pneumonia or any other lung disease. Whereas the one at the right, way healthy, where the tobacco no above it, you see say they able to breathe well because it's healthy. Next. The too much drug or drunker now for left hand. Otherwise, the blood pressure no will go down. Next. We for able to sleep well. Do anything where you able to do for make you sleep well, where you lay down for sleep. Down the back the help for you and the blood pressure. So Monday, now where you go sleep, now they begin remember all but the world problem. That no go solve problem. Next. We for learn for reduce with stress. Whichever way they fit you, whether na meditation, is done quietly for like 30 minutes or 1 hour, just they meditate, they think to yourself. Or sometimes they do deep breathing. You breathe in deeply, hold on for a few seconds, and then breathe out. Or sometimes they massage, or they relax your muscle there. Or sometimes they can do yoga. All down there they help for reduce the stress. Next. Where you don't dey this now for friend group, support group, where una all sometimes get the same problem. Una all they talk about the same problem. Una they support each other. Anything where one person do where you see say make a difference, you do am good. Then share around to the group so that we now all will support each other. Next. As I've been saying before, as you dey do all this now for the monitor the blood pressure on our host. If that day they make you panic, the pressure go up, now for the go na clinic at least 2-3 times a week for let them they monitor, let them they check the blood pressure. Next. As I've been saying, black coffee or caffeine, down there they make the blood pressure go up. So now for avoid them. When we avoid black coffee or caffeine, they make we they become less anxious, we go help we for lower the blood pressure, or it help we for sleep well, we also they lower the blood pressure. Self we teach them to become whiter and more healthy. On the other hand, when we avoid this black coffee or caffeine, it will make the gut able absorb the good nutrients there from the eat what they eat. And all this they help or lower the blood pressure. Next. Next. Una thank you for listening. Any questions?
Okay, my family, Mona, thank you for what I don't listen. Dr. Rashid, plenty thank you. I can't thank you enough. The family, like I already seen at the last session this of the year. Plenty thank you for when I don't join, I don't listen to Dr. Rashid. We don't go through a whole session, but plenty thank you to Dr. Rashid as well. So I know doctors are very, very busy. So for letting all they take time throughout the year for bringing all the wonderful presentation here, we get for say plenty thank you to them all. Okay. I know waiting they go through for them being in presentation here, I know, and it's not that simple. Which that they see, so it take weeks and weeks and sometimes overnight stuff for them prepare all the content here for them be accountable. So plenty thank you. I believe say I don't learn a lot, and I believe so una self don't learn a lot as well. So now at the time for Leona self ask any question we wanna get. I see we get a multidisciplinary team. So I believe see any question you wanna ask for able answer them. However, like I say before, if not personal to you, we need medical examination and results for them able give you that advice. Then unfortunately, we will not be able to get it now. Yeah. But also, if they use any examples way similar to you, not to you really, you would refer to they so telling them to use examples then we can similar to certain people because some of the issues they're linking similar. So you're not missing a particular individual they talk about. Well, thank you very much, Dr. Rashid. So I'll look at the chat and see which questions they will get the first. Then I will go ahead and see waiting else that see if we get any questions. No. Okay. Now me will start because some people in the week in shame. So they are if they shame for talk, type that in chat. We don't show people in before how for do one. Type in the chat and ask a question. But also we don't share the WhatsApp group link. So if you want to join the WhatsApp group, not to your normal WhatsApp group where you go join and boku people and when they comment and stuff like that, and then they talk to you at all hours. This one I've just for past health information. So I'm going to encourage people or join. So if there's anything they will important health information, not to just we will kind of will give when we share stuff on the WhatsApp group. Let's see what that is. Okay. Now make a comment, please. Okay. We see for the Professor Lisk, and he say then quote he say Dr. Rashid quote You want to see anything, Professor? I'm gonna look for you and see. Dr. Rashid, is Sabi personally?
No, I'm not sabi am personally. Na just the work wey dem do na Kenema Government Hospital.
Okay. That's if I keep Fenam. I don't see it too. I don't know if oh, there you are.
No, I mean they talk.
Okay. You Fena?
No, I didn't Fena, but I know I'm personally Professor Lisk. renowned to win a salon. Yeah, Dr. Rashid, thank you very much for the wonderful talk there. If Dr. Lisk want to say something, we'll really be honored for hearing voice if we have for talk.
Yeah, Tej, I think in name himself as Rad.
Rad, yeah. Rad.
Yeah.
Yeah. Okay.
Yeah. And Mr. Fuad, Dr. Lisk been working at Basel then at the time when they do me, say Sierra Leone medical school, you get for go out, work for 1 year before you come complete final year. That Dr. Lisk me arrange for me. I work at the University of the hospital, Basel in Thorax Hospital, and I work with Dr. Lisk there as well. Over to you, sir.
Yeah, thank you very much.
Yeah, get a few dots that lists them actually. So
I think this one is senior, right?
But wait, I don't ask her for unmute, so I guess Ikoka. Yeah, Dr. Lisk?
Yes. Good evening. Yes, I'm glad you for joining the conversation today. It was a very good presentation. Just one or two comments. First of all, the study where we do, it was not at Kenema Government Hospital. In fact, what we did was a WHO-sponsored study where we look at hypertension in Freetown and Potloko districts. It was a community-based study. So we do the hypertensive study as well as risk factors in Freetown, and then we do an Potloko, where we go na Bamoy, we go na Kagbantama, and we go na Binti, 3 villages na Potloko. And we look at the various risk factors in the 2 urban and rural districts. And the first thing we found was that hypertension was much more prevalent than the urban district rather than the rural district. And also we look at risk factors like smoking, education. It was a very comprehensive study. And as well as the Dr. Kotner in presentation, we look at the awareness and the control, which was very, very poor at the time. So since then, quite a few other studies David and don't do. One of the other one are the STEP study where Dr. Samai and the ministry do. I think in 1999 or something like that, somewhere around that time, about just over 10 years ago. Again, they looked at a lot of various risk factors. And really the prevalence, we are really talking about 40%, between 35 and 40% in Sierra Leone, and it's commoner in males, commoner in the urban districts, in people who smoke, people with lower level of education. There are so many other risk factors that we found out. So it is good to mention all the different studies that we don't do. But the main thing is that we know hypertension very, very, very common in Sierra Leone, and even right up to now, because I'm still practicing, I'm a neurologist, we get a high level of stroke. In fact, we've done quite a few publications on strokes in Sierra Leone, both at Conteh Hospital, at private hospitals as well. And there's a very high prevalence, and also we looked at risk factors in strokes in Sierra Leone. Hypertension almost always is the most common risk factor where they affect people and where they cause strokes, etc. So it's a very good topic. It's a topic where everybody will be familiar with, and I am impressed at the way it was presented. I congratulate you and thank you very much for the presentation. Thank you.
Thank you very much, sir. You see, like the benefits of this kind of program. Thank you very much. At least we don't get the professor and don't come. Don't explain. I don't hear from the horse's mouth as to waiting they don't do and the effort they make. And to be honest, that's something we really appreciate, because as far as medical statistics concerned, it adds for we get stuff on salon. It can be very difficult. So it can good way people are they embark on entire here for bringing them kind of stuff here to we. So thank you very much, sir. Anne? Anne? Okay. Sheriff Holloway?
Yes. Thank you very much, Doctor, for the presentation. Very good. But on the reading of the chart for blood pressure, it seems you omitted my age group, 84 plus. Am I already dead? I'm already dead.
No.
Brother Sheriff, Brother Sheriff.
I'm very sorry, sir, for do this grievous mistake. Not intentional. I will make Dr. Bell answer this question.
No. Rashid. Not Dr. Kamara and I for answer this question. Dr. Kamara, I have one to you.
Brother Sheriff, not omission. Just what's the word for it? The extent to which they can take the average lifespan. But that not means that they're not considering, because people know they live up to 100. It's just that you get a cutoff point where they can say, but it don't mean say that they don't ignore that. But one thing you for know is that as they grow older, and that's what the blood pressure they go up.
Yes.
However, you get to keep an eye on them, make it not be say, even though you don't 84, for example, your blood pressure now being 140 over 85, all of a sudden now the blood pressure don't go up to 190 over 100. Then you say, well, okay, that now how many age they go? No, you need to actually make sure say they monitor that and look into them. So anytime you know say this is not the normal pressure where you don't get, and now you don't go beyond that, but you don't get the reason for that. Now forget to talk to your doctor. Way that way they ain't go then know, because now then they look after you on a regular basis. Then go know what for do, how to investigate them, and how to treat you.
Okay. Thank you very much.
Thank you, sir.
Thank you, Dr. Kamara.
Okay, another question we get, sorry, and I'll come back to you in a bit. Another question I get, somebody asks, say, they say, waiting at the feelings or the symptoms, we go show say you get high blood pressure without using the machine.
Okay, I think I get a slide where we talk about the symptoms. I've been mentioned, for example, headache, and your vision can change, so you know they see better, or you aid the tone, or you get chest pain. So that one and then are the symptoms there. But I will also say they're not really specific to high blood pressure. You can get other sick where you get their symptoms then they. However, if you get their symptoms then they will just don't mention again. Now for check your blood pressure. Where they take the reading or then go put that cough now you arm for measure. Then they not your symptom. Now for sabi now, true, waiting at the blood pressure really not your symptom. I don't know if other person want to explain them better.
I see Auntie Nafi and Auntie Angela. Auntie Nafi, you go first. Can you hand first, please?
Yeah. Good evening, everybody. Thank you so much, Dr. Conteh, for the presentation, and really good presentation there. I just want to touch base on Auntie Umu in question. I think if I understand in question well, in question is what signs and symptoms where you will get for let you know whether a low blood pressure you get or high blood pressure without the machine not tell you. Yeah. So in other words, it may not check my blood pressure and they feel some kind of way. How I will know whether my blood pressure now up day or not down day, given all to the type that they give you headache. I think that that's it, and that's it they talk.
Okay, he said question. He said what he want to know. I be able to tell the difference between high blood pressure and low blood pressure without using the machine.
Well, I not really talk about the low blood pressure today. They focus on the high blood pressure. However, if you get low blood pressure, then they can make you aid the tone. And if back you get high blood pressure, you aid the tone, it's difficult for know which is which until they take the reading. Other symptoms then they way can be similar, but apart from that, I believe say maybe some difference will there other than or take the blood pressure itself. Anybody who want to explain that better?
Yeah. Okay. Sorry. Now you talk about low blood pressure. When the pressure go low, too low, you they obviously able for determine that. Then the way the blood pressure can go low, na because something happen. Either the tablet way they take don't lower them too much, or something the way you don't do. Like if you vomit past mark, or you get diarrhea, or you not drink, you get dehydrated, the blood pressure can go down. And when the blood pressure go down, the way you can tell, they begin sweat. That's one important sign. You begin sweat, that cold sweat. If the eye they turn, begin weak, confused. That's not one way. Similarly, if somebody's own blood pressure go up, most of the time people always sabi their own pressure. Then can tell you, the way they feel so today, this my pressure don't go up. It's important for let you know. But more importantly, now make them call them non-communicable disease. The vast majority of the people that we get blood pressure, they don't know say they get them because they don't get symptoms. That's vital. Now make you see we need for actually monitor them because it can get out of hands and it can cause death. There's sometimes when people then come, then they come to me with a stroke or a heart attack. Yeah, or the heart stop. So important for me to know say they're not killer disease. Now make them call hypertension the silent killer. It's so important that, as I say, the big boss World Health Organization decide for that day, 17th of May, to everybody for let we know, say then 2 things here. Diabetes and blood pressure, definitely we need to be able for look into them. Other than that, we don't know even the number of people and we not get diagnosed yet. Now that's not the importance of them. But as Dr. Conteh don't talk about, the other symptoms then, like how they hate the heart, the nose they bleed, you can get shortness of breath. Like we begin work, you go begin blow fast, and of course the eye they turn. All anything then they can be for due to something else. But if you get them symptoms, then they fine, make you get checked out. Now the important thing that get checked out. Not say this is not my blood pressure, but get checked out because it's not normal for lady to feel like that. I don't know if they make any sense.
Yeah.
Yes, it makes sense. And the same thing as well, similar thing way, Dr. What's his name again? Dr. Rad, but again,
Dr. Lisk, Professor Lisk.
That's the one.
Prof Lisk, yeah, Prof Lisk.
Dr. Angela, you want to add something? Dr. Angela?
No. Since Nafi clarified the question, well, I will still add anyway. I remember, things say, maybe feel say the question, they ask about the symptoms. Just want to add, say, Dr. Rashid may not answer that well, and Nafi clarify, and Dr. Karmara don't answer well. Just want to add, say, naturally, we almost say hypertension, and they call it the silent killer. Dr. Rashid mentioned all the symptoms, then, but don't not forget it. And then they even get any symptom at all. So the moment you don't reach, maybe if you get a family history of high blood pressure, I would say maybe from late 20s, by the time the clock 30s, make sure say you get the blood pressure machine where you monitor and also. Of course, if you not get no history, by the time the mid 30s, 40s, try forget one where you monitor and also because until then you go get non-symptom at all. Just want to add that. Over.
Thank you very much.
Exactly. Thank you very much.
Yeah, there's one more question as well from Auntie Umu. It says, what's the difference between heart attack and heart failure?
Okay, that's a very good question. Heart attack, we say the heart is responsible for pump blood around the body, or the 60,000 miles of blood pipe in the body. That's a huge work when you consider the size of the heart itself. So heart failure, now where the hypertension don't get by you for so long, the heart tire. You just tire. You're not able to pump blood again. Now the whole body as how it been done. Heart attack, the heart itself need blood for making it stay alive and doing work. The heart itself need oxygen. depending on we lifestyle, for example, we can eat some eats there where they just clog up the blood pipe them. When that happens, then blood pipe them where they supply the heart itself for make the heart supply the body, then can become blocked. Where them block the heart not get blood supply, now heart attack you get so. I think say now the difference than the if I make myself clear. Anybody want for add they can add.
And I don't have one. Anybody else want to add anything on that before we move on to the next question?
Yeah. When it's a heart attack, the medical expression is myocardial infarction. Now, myocardium, the heart divided to the, myocardium, and then the inside of them and the outside of the myocardium, that the muscle part of them. So, the way you go for able to understand them is that the heart get muscle, and the muscle get them small rope around them. If you look at the cow or the sheep in heart, you can see them small rope then they wrap around them. Well, the muscle way now they pump this blood, now then they independent for let get your own blood. But because they develop this cholesterol, this fat around we body because of who that we be and the kind of food we they eat, if you look at today, you say let me go more towards the plant diet, plant-based diet rather than animal, fat. So these they make the blood vessel, they get blocked with the fat. So that when you exercise, or until you go upstairs or you go uphill, the heart now, they get stressed out because you want to get the blood supply to that area they usai in the pump. When you forget them because the rope don't get blocked by this fat, then the body they cry for that help, and that's what they call angina. Now that pain they now you diffuse, which means the plumbing of the heart now they work. So if you're not able for open now, then I make them give you that spray. That GTN spray when they give way they squeeze under the tongue or under the lip, they open that blood vessel, that property, temporarily, so that the blood go pass through. When it pass through, the pain can less. Like you always tell people and say, if you take that in the 1 term, work, 2 term, work, by the time you get the 3rd term, and for fair hospital load, because it's possible to say you go get a full-blown heart attack, which means the muscle weighing under the heart go die at that particular area there, usai, forget what you want. So that's the heart attack. The heart failure, then more the heart itself need a work, and boku reason then they for let the heart stop for work. One by them na heart attack. So I don't know if I did make any sense. Heart attack can cause heart failure, but heart failure no they cause heart attack. But a lot of reasons can cause the heart not for work, whereas heart attack now because the blood no they go through their appropriate to the muscle for give them the glucose and the blood and energy we need. I don't know if everybody get that clear.
Yep, I think it's clear enough. Until Nafi, I'll come back to you. I'll go to Anne. Anne? Anne? Maybe there's trouble for mute. Until Nafi, you still got something for add? You are still there.
Sorry, in a legacy hand, I can't put on.
Okay, we fumble them. Now the question and then they will get so far. I don't know if anybody else get any further question for ask before we wrap up for today.
I'll get a few things there where I'll go and add, but
I'll get one more question, then I will come to you, Doctor. This now Antium again. He said, does hypertension cause enlargement of the heart? Would I take on Andy?
Okay. I'm not sure, but I won't believe so, because hypertension simply means the heart get for work extra, forget the blood through the body where it used for do normally without much stress. And the heart being a muscle tissue, if he overwork or if they work extra hard, I think there is a possibility, say, it will enlarge, but I'm not sure.
Dr. Kamal?
So,
Yeah. The question again, sorry, because
Yes, it
clearly,
If the question is, if hypertension they cause the heart to enlarge, does
100%.
cause enlargement of the heart?
Now the short answer to that, 100%.
Wow.
Because just look at just think about waiting, then they say how then describe waiting at the blood pressure. You think about it. The description there for you saying that the strength where the blood they get forced out through the them. But imagine say if they do them at 150 over 90 or 140 over 90 or 210 over 100 repeatedly, continuously, which is easy to go up into the heart.
Yeah, definitely.
Enlarge. Yeah.
It's as simple as that, and that's it.
Okay, another question they gave from Antiomu. Now, any dominates today.
It's good, and I make you fine for control them. That's exactly what you do try to prevent.
Yeah.
When you control them, you prevent the complications like that one day they happen, heart failure.
Okay, Dr. Bell, do you are big? Just patient me a little. Now you go wrap up. Bear with me 1 minute. What about congestive heart failure?
now you dey qualify them. You see, congestive heart failure, then they get for do with the fuck them as well. You know, the lungs them, not to just the heart in a yawn, but if you get the lungs them. But I know one old topic, I don't think I will get enough time for explain that. You know, but congestive heart failure, not to diagnose with they make direct like say, the heart don't big or therefore heart failure. No, congestive, you can forget particular study investigation we then call echocardiography, when the ultrasound of the heart. Then they give you that, then you get ejection fraction, you name it, all of that. Another thing we will talk about now, but later on, probably in a topic that we will go come into.
Well, Antiomu, we owe you one. So keep an eye out. When that session they come, I will make sure say personally that you will be, you know. So we owe you one. We will put on there as part of the topic that we will look at next year. And by God's grace, we pray say we all go see next year. And we'll go look at that as one of the topics. If I don't make a note of them, we will discuss them within the team and decide who that will take them on. Mr. Senesi? As you will say, why be doctor? Not a problem.
Hello, you hear me now?
Yes, sir. We hear you now,
Yes.
sir.
Oh, okay. Thank you very much. Yeah, well, me not a doctor, so I'm able to go into details for that. But I'll tell you, thank you so much for all the points we bring about hypertension. You know, me, I focus on the people that are salon. I don't say all the explanation is based on the generic or the general cause and the prevention of hypertension. But I want to go back to the grassroots level in salon because we already said and do some research from salon, from Kenema, from the area and there. So I want to actually look at we waiting at the real cause of hypertension for people they are in a salon. What you get to emphasize on if they give like a community education or health education to people them, what you will for tell them now the causes so or now this over for prevent them. Because now then with man country then go talk say, oh, people that junk food, people that exercise, oh, then got obesity, this and that. But with people they are then they exercise, they not eat them junk food and no more, they do all things. So what you will tell them village people then say, hey, this is not the real cause, and this is not the way for prevent them, for able to help them for the future.
Okay. I will ask, seeing that I don't know if Dr. Lisk they in a position for, because given that you know, that they do that research, they may be able to shed some light on them. Dr. Lisk? Professor? Okay. Dr. Rashid, yeah, you can go ahead.
Okay.
Yes.
Thank
Yes.
you.
Hold on, Dr. Rashid. Yes, sir. Go ahead. Yeah.
Sorry, I don't been getting question we've been asked.
Yeah, waiting, Mr. Matthew, CNCB, they ask, is that the preventatives like waiting they cause this heart condition now we own community, you know what I mean, that's alone. They say because, for example, in the Western world, they go say now obesity, now the junk food they would eat, now the lack of exercise. But we want people, for example, and they exercise a lot. And I know say maybe one part of the reasons they might be because of the starchy food they would eat. But you know, given that you don't do that study in a salon, what do you feel is that the most damaging thing where we they do or with people that they do where they cause for it and they get this condition?
And how they go for preventer?
Yes. You know, waiting for stop for do, we go help them for them not develop this problem.
Well, me not a cardiologist, but from practicing here, hypertension obviously are the most common cause of heart failure because it causes strain on the heart, then it causes enlargement of the heart. Eventually, you get into heart failure. Other causes of heart failure, they can call cardiomyopathy, when the heart can just weak, you know, and you get valvular heart disease, where sometimes the valve inside the heart can tight. But for we, also hypertension are the most common cause of heart failure. And doctor don't talk about all the ways the way for try for reduce the risk of hypertension, the way we can try for treat your hypertension. So obviously, if you're able to treat your hypertension, then you go reduce the chances of going into heart failure. So now the connection that's between hypertension and heart failure.
Okay, thank you very much.
Thank you very much, Professor. I can come in?
Yes, sir. Yes, sir.
Yeah, thank you very much, Dr. Lisk. I think when we say lifestyle disease added to what Dr. Lisk don't say, lifestyle na lifestyle, whether you're in the Western world or Africa or salon. People then they way they smoke in a salon, same way so na UK or US. People then they way they drink rum, perhaps to drunkenness na salon, same way so na US or UK. Yes, by nature of we being a salon, most people they exercise. But again, not to one size fits all. If they exercise, which can exercise? How much? How many times per day or per week? So you find out, say, just because people they know they eat junk food, and they put them in quotes, because I know of people where it no matter, like I been say, how much salt they in the plazas or the rest, where then they eat, then let for sprinkle more salt, now they eat. So all that, in fact, you find out, say, salt and smoking, now one of the most dangerous things that way they cause high blood pressure. Because, as I've been saying, the salt, the extra salt, it cause for let the kidneys then retain water and the salt itself. And when that happens, that means they give more work to the heart. I give una the quiz for reason, for tell una how much work where the heart get. And if you want to put more on that, you will simply get hypertension. But the smoking self, I give una all the list of complications where they come from smoking because of the chemicals that way in the tobacco. So yes, we people they know they eat junk food in quotes. Yes, we people then they exercise, but I believe say the lifestyle where they lead with to hypertension, it can be similar in one way or the other. I don't know if Dr. Kamal wants to add to that.
I mean, Prof, we don't talk. It's just that the kind of thing we would talk about here, not to one factor, no more. They cause that. As we talk, he don't tell you about cardiomyopathy, valvular disease, hypertension. As I say, not to one thing they cause that day. This is the problem here. Now make you find when you feel the symptoms, go get assessed instead of assuming saying that this no more get. It's important because as things stand, you go stay with people in the exercise, but think about the stress when they go through. All right? Think about the food. You talk about, say, well, the food and they eat, but clearly nowadays when they talk about the cholesterol, when one big factor. You talk about the kind of carbohydrates where would they consume that we impact them there.
Yeah.
And of course, we forget about the fact that they run in families. So you get the one that way in natural factors, and you get the one that way in acquired factors. When you add all the 9 of it together, I think it's important for me to say some time. This now food for thought for let we carry on investigating as to why people are within the urban area, they're more likely to get this hypertension than the one that within a rural area. What is it now in the cause that I think say that now one topic where I think say important for let we see whether we will progress on them and maybe do some more research on them. Maybe we can get some sponsorship, which is really good, for let we get to the bottom of it. And that is important, it's vital, because it's important for me to know waiting. You can't just tell me say that the diet, you can't just tell me say that the lifestyle. There has to be something else. And waiting that in the way now we need to find out.
Well,
I'm really grateful for that. Thank you.
I can't play the devil's advocate here. Because for me, I think it's in the way obvious, way most of we know. But maybe we no one talker now or we no remember. One, I come out alone last year. I go a cold, I have a cough. I go pharmacy. Guess what they go give me? Antibiotic. How the nose kind cold I get when they for give me antibiotic. What I ask for, waiting they give me na 2 different things. I me tell the guys I don't want antibiotic. I say if you not get what they ask for, I say let's know. The kind of medication they take, they never do no test, no nothing, they go give you something. Most of the time, we don't even ask, we just trust the pharmacist. And most of them people, I'm sorry for saying this. If I'm wrong, I'm happy for let somebody correct me. But I'm not facing some of them people where they run them pharmacy actually are pharmacists. So their medication and their feel say they contribute. Another thing, processed food, don't boku na tongue. I'm not that old, I'm still kind of, I think they're still young. But what would they grow up? Most of the thing they would eat, nothing that way with the plant naturally, we would get locally. Now, as people, their lifestyle, they change, i.e., then they get more money, then they exposed to social media and movies and all of that kind of, stuff. We feel say when we eat, wait till they see that they movie, it means they live a better lifestyle. Some of them food where they go na tongue, we don't know how long they don't in a container for till the travel go tongue. There's no, I didn't blame any individual, but at the same time, there's no proper control on the medication, on the foods that they eat. So I feel say maybe that might be a contributing factor. I'm just saying. Because the people who in a village, for example, they're not exposed to anything there. They don't get access to anything. So they're small way in the way that they do from time immemorial, like most of them still they eat. But who are they now, Freetown and wherever like that, or they're not in big city, we're not exposed to certain things. We feel say, when we go back home, for example, we come to England, and maybe they eat the potato. If I come out and beat me body back home, they all want to eat beef and all of that. Maybe they stick to me normal stuff. Now I tell them, I say, some of them tell what they eat, and they cause some of the issues they would get. We know to medical process, it's not medical research, not just an observation. And I believe, say, by God power, the powers there be, maybe God go make Professor Lisk, and other people that will do their research here, they go continue for sponsor them, let them do more, let us get some statistics, let us understand exactly waiting the underlying issues they will get in our society. We hopefully will continue for save life. Yeah, Auntie Nafi?
Yes, thank you. I just want to say one last message, and I just
yes, what's up?
No, you name lost. You name lost at the beginning.
That's what I see. Go ahead, man.
Just a message I want to add to everything where everybody don't see about let we monitor with blood pressure them. Especially this message they go for man them. Not to say I just pick on man them because I want for point finger. I know say research don't show say man then are one group of people that way not they access healthcare as compared to women. A lot of man then they now he access waiting at the blood pressure, he will tell you say no. They know they access healthcare. So do you, if you didn't have this call, you know, man, if you not get BP machine safe, or you not get family history of hypertension, just check. You always find for know what's in your blood pressure. If the message they go for all man as well as woman, but man them more because research don't prove and say they know they access healthcare. Most men then they access healthcare we push camp and shove. And sometimes by the time push the camp and shove, the doctors themselves, even if you turn up in hospital, maybe you go down too late. So get a blood pressure machine, go to check, let you know. It better you know early, so you're not a hypertensive patient. You do something about it for prevent all waiting and not talking about the complication. Then touch wood, they just drop you, knock you down one day, no more than say, oh, that person get attacked. When they go to hospital in blood pressure now 230 over 150, you don't get stroke, etc., etc. So that just that message, you know, me they say, let me go to monitor and check. You know, me say pass you forget history of hypertension before you check or family history. That's all from me. Thank you.
Thank you very much, Ma. You do make sense. When it comes to man and seeking medical attention and stuff, me what I know is that also because of the kind of work I do, I constantly sit on me for computer screen, and for a while I'm the crash. But for like I go hospital go do it. Finally, now on this I say January I'll go get it sorted out.
Why not now?
No, this
January.
you go out for that appointment and stuff, but definitely January. But it only happened for a while. For whatever reason, I know the fact and I listen to someone and whatever, but hey. I know,
it's normal. It's normal.
Yeah, that's yeah, go ahead, sir.
We always try for instead of we prevent things, we always try for treat things. Then I can always tell my patients and say maybe 60 to 70% of people when they come to will not even need research if they're going to be prevent some certain things and before they occur. We will talk about the BP machine now also. Some people they buy the third handy mobile phone instead of them go buy BP machine, for instance. You know, so now for people that know say take this thing serious, instead of them they go buy their third mobile phone, buy one BP machine, put on our host, we're for taking the pressure. And also, Mr. Senate, see with the theory in the talk, I find that very, very important for when people also know say, now salon, we get junk food. We get junk food. If you get eat, you rest and per mind in the morning, afternoon, and evening time, then they not junk food.
Yeah, okay.
You know, and people didn't do that. And they also get the rest and per mind, then sprinkle and salt pan top, and they eat that day. And then they actually not junk food. No, and they put the alcohol pan top. You eat morning, you drink your pan wine, afternoon, you drink your pan wine, evening time back, you drink your pan wine. And the same thing with the top pot. You know, so there is junk food everywhere, there's alcoholism everywhere, people in the smoke everywhere. If you don't smoke normal cigarettes, you go to smoke your pipe. You know, so it's everywhere. And you have to find out, say, yes, the problem there in the urban more than the rural, because yes, we can the urban people and not only eat irregularly, because the one thing that people always they forget. They forget, you know, always to care for do it waiting you they eat, but also when you they eat. And they don't find out, say, the way we support for the eat now actually support to get 2 meals a day. One in the morning at 10 a.m. and one in the evening at 6 p.m. And in between, now water actually to the drink. You know, some people are not going for do that day, but if you get 3 meals a day, that's okay. But you get a lot of people then go eat them biscuits in between, they go drink them soft drink in between and all that thing. All that thing, and then they cause people to gain weight. You know, they lose weight through exercise. And also I don't disrupt Boko people and thoughts right now. But you know they lose weight.
So I will make a small.
Exercise. You they lose weight through you regular meal time. 8 and 10 in the morning, 8 in the and 6 p.m. Now so you be able for lose weight. Exercise good for the heart, good for your condition, good for the muscles, good for the bones. But you know they lose weight through exercise. Why? Because your body they actually adjust. There's a study where they do of a tribe in Africa, I call it as the Hamza tribe, Hunter tribe, and they find out say the calories where they burn every day, like the same calorie where the average European they burn. Although they're not Hunter tribe, because they find out say the body they adjust. If they find out say you they exercise too much, the other thing the way they burn energy pan, the body they reduce them. So they come back to plus minus 0. So if you're not positive where they do regular exercise, and not at the top of regular exercise, yeah, it help you for your heart rate, for your muscles and bones. But the thing where somebody for do for, and you're able for maintain your weight. But we talk about for lose weight, exercise will play a role, but a very small role. The thing where they make you able for lose weight. Now, if you actually look what you eat, make sure so you get a balanced diet, and you separate your meals. And the most ideal one now 10 a.m. and 6 p.m. Some people can say I will eat between 10 a.m. and 6 p.m. Wrong. You will eat only at 10 a.m. and at 6 p.m. And the other thing back way, then one issue. The other issue I want to talk about is that there is a correlation between the heart and the penis. When we talk about man, the blood vessels then at the heart are 3 millimeters. The blood vessels na the penis now 1 millimeter. So if somebody they get erectile dysfunction, if for checking self, if for actually that a symptom where he cause that person for to get heart attack later on, because your penis they react faster because the blood vessels were they even thinner than the blood vessels in the heart. I mean, a reproductive medicine specialist, I deal with man and woman, and I want to know the will know. If somebody gets erectile dysfunction, Dr. Conteh don't talk as well. So now one area and the back person get high blood pressure, then it certainly affects. But they affect them because the blood vessels in the penis are only 1 millimeter compared to the blood vessels in the heart when about 3 millimeters.
Wow. The only thing about the diet stuff, me not 2 meal I can get on the one, but me that 10 a.m. one, I'm on it too early for me fast. Right? That 10 that they sleep. So that morning, to be honest, a bad habit I know say I get. And we don't talk as well. Fatima, we don't check me on that day already. I dey try, I dey improve. So if I'm with them, when I don't hear waiting the bookman they all don't talk. Let we try for change your lifestyle. We need change them because of waiting they don't say. But we dey change them for we your health and we picking up. Dr. Toure, I dey come to you. He like you on our way, they talk. This is the last session this of the year. All man they talk now so today. Dr. Toure, I dey call you till they talk. Dr. Toure, what's I don't go?
Yeah.
There we go.
Yeah.
How are you, sir?
Yeah. I'm fine. I'm good. Thanks.
Yes, go ahead, sir. Make your contribution.
Yeah, I think Dr. Rashid, thank you so much for the session. It was really detailed, and I think Dr. Kamar, Dr. Bell, Dr. Ansus, Nafi, all them, put valuable contributions, right? I'm not going to repeat what I say, but that one thing when Nafi talk about man, they know they can take their pressure, they need to do health check. That is very evident, not only Salon, all over the world. Hello?
Yeah.
Hello?
Yes, we're there.
Yeah,
you. Something come up as another quiz. Right. So the key thing, the one thing I want to mention, I know you don't talk about heart failure and everything. Somebody mentioned congestive heart failure. That it has to do with terms, with the terminology, basically. But we'll talk about that in like Dr. Kamal. So we'll make a session about heart failure. We'll talk in detail about that. Now, regarding the check and the high blood pressure, I want to let Mande know say one thing we common is Mande as they grow old, it has to do with erection. So I hope say picking up in another day and everything, everybody they are an adult. But I want let Mande know say most men there as time goes on, I think when they talk about when they get problem with erection. And I want to let them know say the blood pressure, the high blood pressure, cardiovascular disease can lead to erectile dysfunction. It can make you a manhood not work properly, right? So that sometimes not a symptom. Erectile dysfunction itself is a symptom of a cardiovascular disease, right? For let you get that side and they, get your manhood enough, you need to get enough blood supply. So if the blood supply not good, that then end organs, you know, good. It can lead to the injury. So this, I just mentioned this, you know, for the man, you know, say it's vital for the human starting age, for let they go, let them check you. Okay, and of course we don't talk about prostate and other things and the thing and the back you need for the check. We annually, yeah, if a man doing they that way, you know, medical system free for them, they hardly go, let them go even do the annual check. If you're not Afro-Caribbean, after the age of 40, 45 years, you need for the go do that annual then they find. Okay, because then they can affect relationship. Okay, and the man not gonna say na then they happen. Then we don't see a number of people, cases them last alone people who we know where then just you know more say this person I don't for die. This person I don't wait and could die. Of course we know say things then they around where when they accident and so, but we don't talk about heart attack. People if you just you don't know what they get heart attack, they say just get chest pain. They talk to her yesterday, just call Allah no more chest pain, he died. Or then they make palaver out somebody, he shout no more, he died. So all anything they show say, they call maybe we need to do that routine check, right? The blood supply to all the organs, and Dr. Rashid don't talk about the blood supply to the heart, can get clogged up, the type of food they eat, and even the pressure again, the vessels, they overwork. So many they even lead to blindness. You know, maybe Dr. and Dr. Rashid maybe mentioned about the complications. They say it can even lead to blindness, erectile dysfunction, blindness, and other things, kidney problems. It can lead to a complication. So the take home message here is, no, we not just see and say this is blood pressure or a common thing, right? It can lead to things that will later on will affect you and your family and your whole life. They affect them. So, now we take time, now we check, you know, being able to buy the blood pressure machine for yourself. You can get a nurse around, we can check the blood pressure, and even for check blood pressure, not you need to get somebody where you really know how to check them. And then secondly, you get a target where you need for where based on your age, after a certain age, you get target of blood pressure where you need for maintain. And if you get certain condition, you get a blood pressure target where you for him at. So all that you they talk with the doctor. And somebody asked about the symptoms, hypertension and hypertension. I think Dr. Antis and Dr. Don't mention that the day so you well can you this nothing, no symptoms you not get, but you get really high blood pressure. So many when they go check them blood pressure, you ask, you get this blood pressure is still there alive. You see, so it sounds like a simple topic, but it leads to so many other things. Then. So I need to talk much, but I just want to mention say every man or every woman after a certain age, please go for let you do annual check. Not only blood pressure, but other things and the prostate, PSA, and other things and do the check. So I can stop so. And I want to thank you all we listen to the program today. Thank you.
Thank you very much, Dr. Turi. If nothing not scare me, well, I don't know for now, but if nothing not scare me, I don't let me pump lock. Let me pump the one. Okay, so definitely what I need for do I good.
Change the verb there.
And one last thing. One last thing concerning that one that we get high blood pressure, we they take medicine. I don't meet people, then they get high blood pressure, they take medicine, then they only take the medicine when they feel like say their pressure don't go up. Then they feel sick, and when they don't take the medicine, they don't heal already. They don't need for take the medicine, and they take her when they feel sick, when they get the symptoms there. People that I beg do ya. Oh, now when they get high blood pressure, well, now they take on a medicine, and I forget what take her regularly. When I go for buy them, when I go take her regularly, when I go for go to doctors them also regularly, for making them check them, for making them see say the treatment they work. Dr. Conteh don't show now almost patients then diagnosed, and the one that we then diagnose, the one that we get treated, and the one that we get stable blood pressure. You know, so the reason why I make people not get the stable blood pressure is because then they take the medicine regularly, and also then they go see the doctor regularly. So if they diagnose you with high blood pressure, you go take medicine take your medicine regularly every day, like how the doctor talk, not when you get symptoms you take them. And secondly, you have to go to the doctor regularly for checkup. You will get high blood pressure, forget blood pressure machine hours. There's no reason why you cannot see anybody when diagnosed forget high blood pressure, not forget blood pressure machine hours.
Thank you very much, Dr. Bell. Before Mbulem, una don hear all the good things that we they don't talk today, the doctors they don't talk today, but also for the whole year, which we don't talk. Every good thing therefore come to an end. I know me at the beginning of bad news, but I'm sure una self go agree say then Gaia they self need some time for rest. Then they enjoy the festive period, and we will come back to una in January. So before we lock, I go ask each of them let them do now their last word. Then we will finish for today. Auntie Nafi, I'll pick on you, yes.
Good evening again. Thank you so much. Your last word I get, I just want to thank everybody who joined in actually and listen to it. And I hope say we will find the session very informative and helpful, you know, and wish you all Merry Christmas in advance and a Happy New Year. We hope to catch up with you again next year. Thank you.
Thank you very much, ma. Dr. Bell?
Yes, still around the way they up to this 30 of we're still there on, and thank you for when they're on. Please, please, please not spread the word. We need for make more people that hear this message, and so we need for make not only medical professionals or doctors, nurses, but also ordinary learners that come on board and listen to this message. And so because the one person you tell, you might save in life, or that person you go tell other person we will save in life. So with each and every person we can join in here, so can be beneficial to the one who country. Yeah. So please, 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 when I spread the message, when I always say well body better past gentry, I wish you a Merry Christmas and a Happy New Year.
Thank you very much, sir. Dr. Ture?
Yeah, I think all people for una can join with today and all throughout the year una don't be join with. So we wish you all Merry Christmas and Happy New Year in advance. And una not forget una go through the YouTube channels them and we watch all the program there in your free time. If you watch them or listen them, if they drive or they ensure that people let them listen to them. And in a nutshell, anybody we they always try for the do your own basic health. Health is wealth. Health that surpass £1 million or dollars in the bank. Okay. Until then, we meet again next year. We tell you now. Thank you.
Thank you very much, Dr. Ture. And today, Dr. Ture, the melt by the way he talk. Dr. Ansels?
Thank you very much. Everybody for that session. Special thanks to Dr. Rashid and a very special thanks to Professor Liz. It's like you say then they mention a study where he conduct and they for giving more about the study. Me just want to remind on all, yeah, and thank you on ourselves, John. Una not forget. If you don't diagnose with, they don't diagnose you with blood pressure, get you machine where you check, they're not really there, honestly. If you get alone, you get fumble, now you them to send them for you. Slightly they monitor them. Even if they're not diagnosed you itself, if you don't reach 30, make sure say you check them regularly because I'm a silent killer. Una not forget say, well body it better pass gently. Merry Christmas, and I wish you all a blessed 2024. I will soon all next year by God in power. Over.
Hey, is your person have talk? One day what big I will be like you. Uncle Doc, you go able to wrap up Anne in question and you final word, please.
What is the Anne in question?
Let's see if I cable fan I'm back. I'll send them to you. Yeah, gonna give last word number laugh in the question.
Okay.
Yeah,
thank you. Go
so
on.
One quick one. He say get high blood
pressure.
Yes,
yeah.
And he on medication for him. He say, but he also get asthma and they eating weight and they take steroids. When he gets chest infection, they really struggle with that.
They struggle with waiting.
He say now it's kind of understand. So he say he get blood pressure and he on medication for it. But he also get and he also
you get chest problems as well.
Yes, and he struggle with weight, and which and because of the weight,
Is a struggle with weight.
yes,
Yes, okay.
Steroids for that, but he gets chest infection. Or they struggle with that, but you say when you take the steroids, he gets, I think he get chest infection, I think.
Well,
he say, thank you very much for the content and the presentation. Really enjoyed it. I have high blood pressure, but on medication for it, and I have asthma as well. The problem I have with, I don't know if with weight is when I have to take steroids. When I have a chest infection, I really struggle with it.
Yeah, and I think what she's saying there is that this is a catch-22 situation whereby she's got the chest problem, which when it flares up, necessitates steroids as an anti-inflammatory to calm down the inflammation in the chest. And one thing the steroids do is they add on the weight that you put on the weight with it. So now if you are hypertensive as well and you're trying to lose weight, then it becomes a difficult one, because you're trying to look at trying to curb the infection while taking the steroids. At the same time, you're adding on the weight. At the same time, you're trying to get the blood pressure sorted. So it's not a straightforward answer. It's not like a silver bullet, put it that way. In most of the things we do, like the GPs will tell you, is robbing Peter to pay Paul. This is where things are. As things stand, when you get a flare-up of the chest, you take the steroids for maybe a few days, maybe 5 days, and then thereafter, you taper it or you come off it, and then you continue with the blood pressure issue to try and get it under control and continue with it. That's the way it is. It's not anything you say, I'll do this instead of that. It's one or the other. That's how things work out. And sometimes you unfortunately have got to face both of them at the same time. But I think the best thing for Anne is to probably get the GP to review the medication at any point in time when she decides to want to do that. Because as I say, if she is now in remission, if you like, or she's not having a flare-up, then perhaps the blood pressure needs to be looked at in terms of controlling it. However, if she's got a flare-up of the asthma or the chest problem, that needs to take priority, because the first thing that would kill anybody is the airway, followed by the breathing and then the circulation. Okay. I hope I'm making sense.
Yes, you are. Yeah. Right. So what's the last one for me for today, sir?
Well, as I say, we tell all man thank you. They don't do well for we don't go from we'll see professor them, we'll see minister them, we'll see teacher them. It really, really, they make me feel happy, feel joyous. Say, yes, indeed, we did do something. People in the comeback and tell we say, we did do something positive. People in the laboratory in higher places. Now that's not the thing where we all set out for do. If we're not there in the country, we never go there. It not means for just lefando. Now that make we come together as a group for trying for do we only learn nothing for learn we push things forward and help people them. At least, educate them, at least create the awareness, sensitize them, as I can say, for make they're able for no say that power way around the corner, not to get the answer. The answer they now the one the way land that profession, we land that book day for let them for do it. So they are definitely want for able for go get checked out, because they see care, then they kill. Now make them call them non-communicable diseases. We know that. One pandemic we don't talk about today, the other one diabetes we will talk about later. We will not talk about them before. So now can't hear the one day when they don't diagnose itself, the boku pass the one they didn't diagnose, believe it or not. So let me not left things late. We will talk about waiting at the complications of the medication for the blood pressure control at another time. But for now, we wish you now the best of the holiday season. Make you enjoy yourself, and we self take a deserved rest. And then by God's grace, by God's power, we all go see yourself again early next year. So have a lovely rest, have a lovely holiday. And remember, wherever you go, well body, naim better pass gentry. Thank you so much.
Thank you very much, Dr. Kamara. Dr. Rashid?
Yes, sir.
Professor. I don't left anybody else? Anybody else? Okay, Dr. Rashid, over to you, sir.
Una thank you, plenty thank you. Me aid big today for 2 reasons. Number one, I see me pastor come, the pastor na Freetown. Number two, me brother come, me brother there in the US, Philip Conteh, the pastor, Pastor John Moiba. Then me teacher, me French teacher, my boys school, Mr. David Silla. Now, thank you. I know say if for anything else, that why I plus all the one that will come, some of not sabi, and go share with 1 or 2 people there. And so the message will spread. But I also say plenty thank you to Professor Lisk, we make time for attend the session today. You know, me not the bobo na this group, but I'm not afraid for go chakra trouble, because I know say the big one they all did the end. So when I get trouble no more, I run to Dr. Bell, Dr. Kamara, Dr. Ture. So me na the Trangayes bobo we no the afraid trouble. Where I get difficulties, I dey run go to them. So I want to tell una all thank you. Una don't know what don't happen behind the scenes. Me and Nafi and Dr. Kamara battle out. Even to the last minute, me and Dr. Kamara, the battle out. I feel honored for them at the school, but I also feel good because somebody thinks we people them just need them kind here for educate them, for give them power, for able to decide for them well body. And I thank you, and I enjoy the festivities, and by God power, come January, we will meet again. And I thank you.
Thank you very much, Dr. Conteh. If I'm I don't get much for say again, but more so we demand them. Until we need for do stuff, Lord, make sure say the pump they run. So till we meet again, happy festivities, and by God power, we go see again. I think I'm waiting laugh for. By God power, we go sleep, wake in health, and we go see again in 2024. Well, body, a better pass gently. Good night.
Thank you. Now your language make I laugh.